Today we're going to be talking about my top 5 tips on finding a safe plastic surgeon in Mexico. Here we go. Website. It's called Medigo, and it's the title of the article is How to Find a Safe Plastic Surgeon in Mexico. In order to be a plastics doctor, and understand that there's a difference: cosmetic surgery and plastic surgery. Hold that thought. Y'all, I just wanted to interject something that I didn't get to break down yesterday. Sorry I'm looking rough today, but I wanted to make sure I put this in this video before I uploaded it. So you understand the difference between cosmetics and plastics. Plastics have more specialized training and do a residency where they do a lot of reconstruction. Cosmetic surgeons they can put in an implant, but if something goes wrong when they insert that implant, a plastic surgeon has more training in reconstruction should something fail or go wrong. They do a lot more general surgery type of stuff, or reconstruction. If someone has some limb issues or whatever, it's part of their training. That's why I think it was important for me personally to choose a plastic surgeon. So a surgeon who is Aftercare certified, go many years of education, and they get general medicine for 6 years. They do general surgery for 3 to 4 years. Then plastic, aesthetic, and reconstructive surgery is 3 years, and then they do a residency of 1 year. So it's almost longer than what the U.S. physicians go through. These surgeons need to maintain a high standard by attending training courses similar to the U.S. Any member that falls below the expected standard can lose their certification. So that's what you need to know about the Mexican Association of Plastic, Aesthetic, and Reconstructive Surgery. So what that means for you is the first thing you need to do when you're researching your physician or your plastic surgeon that you're considering, if they are in Mexico, is to look them up on this website, okay? You will type in their name in the search field, and it will come up whether or not they're certified or not. If the person has told you that they're certified and it's not there, my best guess, if you don't find them, is 1, they're not telling the truth, or B, they're under the cosmetic surgeon. So look them up there. There is like a very popular surgeon. He is cosmetically trained, who does surgery in Tijuana. He's very popular. Women tend to go to him for the more snatched look that everyone's looking for nowadays. What accompanies that, though, is that there is more aggressive lipo. Understand that if you do aggressive lipo, which is not usually allowed in the United States to the degree that it is in other countries, there is a risk for lots of blood loss that can put you at risk for, what's worse, death. Okay, so those are the things you have to consider when you are considering how many procedures you're going to have done. And if you're going to do lipo, to what degree you're going to do it. Take in consideration a physician that, whether or not they're aggressive or not, look up their outcomes. And the way you do this is, 1, you can always look up their outcomes to see if they've had any deaths or any serious complications, etc. Look up the facility that they're in. That's number 2, is look up the facility that they're in. Making sure that there hasn't been a high rate of incidents. A lot of times you'll find that if there's a lot of infections with someone, usually it's cases of multiples, and it had to do with lack of sterilization, etc. And you'll usually find more than one case. Now, of course, you understand that can happen in the United States. But there have been a rash of cases of people that have gone down to, let's say, the Dominican Republic or Mexico. I think it's more highly publicized just because of the taboo of medical tourism, have come back with crazy, non-treatable MRSA or flesh-eating bacteria. So make sure that you just Google the facilities that they're doing surgeries in. You go on to realself.com. That's another tip that I have. Number 3 is understanding that Real Self does not have all of the plastic surgeons on. That is a paid membership, so some of them are not listed. That doesn't necessarily mean a bad thing. That also doesn't necessarily mean that you can't find real information about their outcomes just because they're not on there, because there are other ways, which we're going to talk about next. So look up your physician on Real Self to see If anybody has any complications, they are able to post their outcomes on there, okay? And you will find some people that say, I got an MRSA infection in my hip and I lost 56% of blah, blah, blah. This is number 4, is to join Facebook groups. Now, let me caution you, most of the groups that are related or associated with that physician or plastic surgeon are usually monitored by someone that has a vested interest in it, whether or not they get kickbacks from monitoring the group, whether or not they're getting surgery free, whether or not they work for the physician and they're doing it under another name. There's a reason why a lot of times negative things get omitted from groups, or there's bullying when someone has a bad outcome, and they'll block you or whatever. So my best suggestion is, 1, to get involved in that surgeon's group, and they'll call them dolls, like Dr. So-and-so's dolls group. And that's a good way to find real-time information based on, your sisters that are going, your surgery sisters that are going with you, posting pre-op instructions when you have questions and you can't get in touch with your coordinator. You can see before and after pictures of the people that have gone before you. You can ask, anybody did this? Did you have this complication? Best place to find before and afters. But as far as negative outcomes or honest opinions, sometimes, and not all, some of those groups will allow to talk about complications, as they should, because complications do happen even in the best of situations. But even still, you need to do your due diligence and get in other support groups that are not related to that physician. So, it may be a general women's support, plastic surgery support group. There's lots of those, you all. There's ones that are related to surgeons just in the U.S. There's some that are related to surgeons out of the borders. Maybe you're interested in going to the DR. Maybe you want to go to Tijuana. People go all over. Santiago, they go everywhere. So look for groups that are not related to any specific physician, and ask the question, or go to the search at the top and type in the doctor's name that you're considering, and all of the posts related to that person will come up, and just start clicking through them and do your research. Ask the question, has anybody had any negative experience with so-and-so? I'm interested in them. I would like to hear any more of their background, okay? The other thing is, understand what you're getting. So understand that when we say we want to, the big thing is to get a mother's makeover. You want everything done. If you have a higher BMI, I want you to consider to be kind to your body. It may be prudent for you not to do everything all at once, because it does increase our risk factors when we don't have a low BMI. You still want to be able to have enough fat if you're doing fat transfer to go to other places. So sometimes people elect to either gain weight if their BMI is too low, or like me, when my BMI is on a slightly higher side, I do want to lose an additional 20 pounds before I go to have the best outcome, but I do want to preserve some fat, because I do want to have some fat transfer to the gluteals, just because I wouldn't bless in that area. I had the opportunity, for example, myself, to do a lift, which is what I wanted. I don't want implants, and also my tummy tuck that I so desperately need. And the physician said, I can do it, but I prefer not to, because that's a long surgery. It can take hours, 6 to 8 hours, for someone to do a complete reconstructive surgery on you. That is very difficult for the body, especially if your body has quite a bit of work to be done, a lot of loose skin. It's complicated surgery. There can be quite a bit of blood loss, and sometimes it's in your best interest if you don't do it all. So if you have the opportunity to split it up, do it. Also, when you go to have your evaluations, of course, it's always best to do an in-house, in-person evaluation. If you have the opportunity to fly there and see multiple surgeons, that's best, so you can find your best match. I do recommend that you evaluate more. If you're not able to do it, ask, can they do a phone or a video conference? Because sometimes they'll have you pinch your skin or do whatever so they can see if it's visceral fat, if it's on top of the muscle. So take a look at, different options when it comes to getting a quote, not just emailing someone pictures. A lot of times you can ask, and they'll do a video conference via WhatsApp if you're out of the United States, okay? So the other thing is to evaluate and have more than one physician evaluate, because sometimes you'll have physicians that, plastic surgeons that are just in it for the money, and they will opt to get you to do things that you don't necessarily need. For example, my surgeon is very conservative, and there are some people that believe or have been told that they just automatically need to have a tummy tuck, and if they don't have a lot of a pannus or drooping skin on their stomach, slightly loose with you know, a minimal amount of fat, he will elect not to do a tummy tuck, because there is some retraction of skin for people who get liposuction, and so they don't necessarily always have to have a tummy tuck or a mini tummy tuck. So take a look at that. So that's the other thing, is to evaluate physicians based on their style and ask questions to people. Go back and say, I got a quote for a plastic surgeon for this. I don't think I need that. What do you all think? Because a lot of people in these groups are well researched. You'll find a lot of nurses, a lot of plastics people who they could go in the United States, but they're going out of the country to save $10,000, and they'll give you honest, really good information with experience. There's a lot of wound care nurses that have seen the good, the bad, and the ugly, and when people have complications, they give great advice. So that's another thing. For me, it was a big deal for me to be able to go to a place that can take care of all of my needs. Surgery centers typically just have they don't even keep, a lot of them, some of them can't, do they keep the patient overnight there for observation, or do they send you directly to a recovery house? That's a big deal, because you want to be able to have aftercare, because your hematocrit, your blood loss can affect you. Your hematocrit can drop significantly, which can be an emergent situation. So I always recommend that you find a place that can keep you overnight, at least one night before you go to recovery center, so they're able to monitor your vital signs and do a follow-up CBC to make sure that your blood levels are okay before you're discharged. So does the surgery center allow for overnight stay is a big deal. You know, it can be a hospital, but if it's a smaller hospital without other services, how good can that do you? If that is the case, then you need to ask the question, if in the event I have significant blood loss and need a transfusion, what will happen? Sometimes the answer is not what you hear. Sometimes it's them getting in a car to go drive somewhere to get blood for you from a blood bank. I don't want that. I need that stuff in-house, okay? Just for me and my comfort level. Sometimes it may be that they need to transport you. The question is, where are you transporting to me? In the event that something severe happened and you needed an ICU, where are they going to take you? How far are you from the border? What happens if you need to be transferred out of the country? So those are all the questions that you need to do your due diligence and ask. You expect the best, but plan for the worst, okay? So that's my best advice to you on finding good care and questions to ask on finding a safe place for your surgery. I chose my physician based on he is more conservative, but still does a really good job with bariatric patients. The other thing is, if you're a bariatric patient, see how many bariatric patients they see, because that makes a huge difference. I found locally in the area, I wasn't happy with the surgeons here, so I wasn't motivated by a lack of saving money per se. I was motivated by experience with bariatric patients. We just have a different set of things to overcome. For example, more loose hanging skin, and it's difficult to pull that skin tight. The American standards doesn't allow, a lot of their tummy tucks don't do lipo with it, and so a lot of people will fly to the DR and have real aggressive lipo. I didn't want that because the complication rates are so high. But in Tijuana was a good balance between the standards in the US and here, but they do a little bit more sculpting than what I saw here. Not for all plastic surgeons, but the ones that were local to me. And so I like the outcomes. He does a very good tummy tuck. I'm looking forward to getting back to the more hourglass figure I once had. But, you know, he still was prudent enough to say, I don't want to do this with that. And I suggest that you don't if you don't have to. The other suggestion I have is ask the question how many cases they do a day. Plastic surgery is intensive surgery and it takes a long time. There never should be multiple cases at one time. I've heard cases, especially in the DR, where they're running people like a meat market. Even in Miami, I've heard this, where they'll have assistants start one case and have the physician go from one case to the next, and the assistants have done some work and the physician wasn't there. You need to ask those questions. How many cases do you two do a day? If they're doing more than 2 a day, it's a problem. If they're doing a complicated case, it really only should be 1 a day, because those are 6 to 8 hours a day. So find out how many cases they're doing a day. Like I said, it should be 2 max. If they're doing 2 max, they're usually doing someone that is doing one or the other, breast and this, tummy, tuck, and butt. Those cases shouldn't be 6 to 8 hour long complicated surgeries those physicians are doing. So that's my best advice to you. My surgery date will be coming up after my right around my anniversary date in July. I have 20 pounds to lose until I get there, and I'm real excited. There's a lot of self-esteem issues wrapped around the amount of loose skin I have. So your prayers are appreciated, and I'll keep you updated with my weight loss as it gets closer. All right, you all take care. Bye. Thanks for joining Mom Saving Grace. Please like, share, subscribe, and hit that notification button. Have a blessed day.